for fibrosis, and I think we have experts talking about that later, so I'm going to defer to them because they're going to give you a better, more thorough answer than I will. So. All right, so this question is, are there any specific dietary restrictions or advice long-term? So, you know, this is the low-fat diet, high exercise that is recommended by the American Heart Association, and this is available to all of you on their website. It's americanheart.org, and this is the Heart Healthy Lifestyle. There's multiple links to it, including recipes and dietary recommendations, and these obviously include low-fat, lots of vegetables, lots of fruits, and a high level of exercise. And again, the purpose of this is to prevent coronary artery disease as an adult that can, sort of on top of the coronary artery problems that have occurred with Kawasaki's disease, worsen.
So one of the questions is, my son didn't receive IVIG treatment until day 13. Are there any higher risk of complications? The answer is, unfortunately, we don't quite know, because the way the initial study was designed was that the reduction of coronary artery abnormalities from 25% to 3 to 5% were done within the first 10 days of illness. What I can say is that gratefully your child was treated appropriately, and that we do this all the time here with children that still have inflammation even after day 10. Because we feel that there's definitely a benefit. As a clinician, we can say that we feel that there's a benefit even though it hasn't been studied that way. The other quick question was, there's a very interesting question here about educating the community about a child with KD who was misdiagnosed many times, and that it's very frustrating from the family's experience to have this happen. What can we do to help educate parents, doctors in our community? Flyers at school. So I certainly welcome this. Dr. Burns will be speaking a little bit at the very end of the symposium about what you as parents can do to help us. Community education is a huge issue and a huge outreach that we work on. And if any of you have any resources that you can help us access in your community, whether it's a health fair that we can help you with, whether it's physicians or we work a lot with, my husband's an emergency room doctor, so I can say this, we work a lot with local ERs that misdiagnose our kids with KD to try to educate them. So please let us know where we can be of help. We certainly can work with you. We have a lot of information and resources and flyers that we can hand out, and we're willing to do that. And we can do it both in our Spanish-speaking, English-speaking, and also our Tagalog-speaking communities.
So there's a question about immunizations, and I'm glad someone asked this. We've been getting a lot of calls about H1N1 vaccines. So yes, the vaccine's safe. Yes, your children should get the vaccine. Yes, your children should get all vaccines. The only caveat is, and this is in the handout that you get in the hospital, the live vaccines for the first year after Kawasaki disease, and those would be the traditional live vaccines are the chickenpox vaccine, or varicella, and the MMR, which is the measles, mumps, rubella. Those two live vaccines need to be delayed, not because they're dangerous, but the vaccines won't work well in your child if they are within a year of having received the IVIG. So those two vaccines only. Right now, in some communities, for some people, only the live H1N1 vaccine is available. And even if your child has recently had KD, we don't have detailed information about the antibody titer in that IVIG. So we say all the flu vaccines are fine for your child. And yes, you should get them. And there's no evidence that the immune system is abnormal or has been affected by the disease.
Okay, let's see here. Got a lot of great questions. You guys did really good. Okay, are you seeing KD patients without acute onset of aneurysms presenting years later with heart wall thickening or stiffening? The short answer to that is one of our questions, research questions, that the research group is working on, and I think we will have an answer on that later in the next few years, but I think that the short-term answer is probably going to be that there is going to be some abnormal stiff, the heart is going to be abnormally stiff, and whether that has any clinical significance whatsoever or not, I think that's sort of in evolution. And that question goes on to ask, what is recommended for monitoring and testing of kids who are cleared following the acute phase? And that's a great question. This is something that is in evolution. If you had asked us that question probably 2 or 3 years ago, we would have said, well, maybe you don't need to have any follow-up at all. But I think now we're going to be recommending for all of our KD patients follow-up on an every 3 to 5 year basis with variable testing depending on what your situation was at the time of the disease.